This one vitamin repairs 9 problems in humans. Are you ready to embark on a journey of health, vitality, and vigor? Ever wondered how a single group of nutrients can influence so many aspects of your well-being? What if I told you that B vitamins could be the key to unlocking a world of benefits? Imagine having the energy to conquer your day, and also at night, the mental clarity to excel, and the heart health to live life to the fullest. Have you ever wondered how your body manages stress or how it creates those vital red blood cells? And did you know that B vitamins might hold the secret to maintaining your mood and supporting your immune system? So, join us as we explore these most asked questions and unveil the 9 surprising benefits of B vitamins. Before anything, please note that the information provided in this video is for only educational purposes and should not be considered as medical advice. Please don't forget to hit that subscribe button and join our community for more insightful content. 1. Clean arteries and heart health. Are you aware that heart disease is a leading global cause of death? So, taking care of your heart is not only important for life, but also for your health. Homocysteine is an amino acid derived from the metabolism of dietary protein. High levels of homocysteine in the blood have been associated with atherosclerosis, which is the buildup of plaque in arteries that can lead to heart disease and stroke. Elevated homocysteine can damage the inner linings of arteries and promote blood clotting, both of which can contribute to cardiovascular disease. Here comes the benefits of B vitamins on cleaning arteries and helping the heart condition. Vitamins B6, B9, and B12 play crucial roles in the metabolic pathways of homocysteine. Specifically, vitamin B6, also called as pyridoxine, helps in the conversion of homocysteine to cysteine, which changes to another amino acid, whereas vitamin B9 and B12 help convert homocysteine back to methionine, which is its own precursor amino acid. By assisting in these metabolic pathways, these B vitamins help maintain lower levels of homocysteine in the blood. There has been interest in using B vitamin supplements to reduce homocysteine levels and thereby decrease cardiovascular risk, including dietary sources rich in B6, B9, and B12 can be beneficial for overall health. Good sources include fish, beef liver, potatoes, and non-citrus fruit for B6, leafy greens, legumes, and fortified cereals for folate, animal-derived foods like fish, meat, poultry, eggs, milk, and fortified cereals for B12. 2. Energy booster. B vitamins hold the key to energizing your body, particularly B1, B2, B3, and B5, are significant factors in our system, tirelessly working to convert the food we eat into usable energy. Each of these vitamins has a special role in breaking down the different components of our food, like carbohydrates, fats, and proteins. Vitamin B1, commonly known as thiamine, assists mainly in turning carbohydrates into energy. Riboflavin, or B2, aids in several reactions, promoting energy production at a cellular level. Meanwhile, niacin, also known as B3, not only helps in metabolizing food, but also in processing alcohol, a substance that can often toll the system. And then we have the versatile pantothenic acid, or B5, which is central in producing energy from our dietary intake. Isn't it fascinating how these micronutrients working in the background facilitate such a vital aspect of our well-being? A balanced diet ensures we reap the benefits of these vitamins, promoting a healthy and energetic life. 3. Nervous system health. Vitamins B1, B6, B12, and B9 are vital pillars in safeguarding nerve function and fostering the creation of neurotransmitters, the chemicals that transmit signals in the brain. B1 aids in the relay of messages between nerves and muscles, supporting muscle coordination and memory retention. B6 is crucial in the production of neurotransmitters that modulate mood and stress levels, acting like a manager overseeing smooth communication within the brain. On the other hand, B12 focuses on nerve cell health, even helping construct their protective shields. Meanwhile, B9, or folate, supports red blood cell production, contributing to DNA formation and protection. Isn't it remarkable that these vitamins, often unnoticed, stand as guardians of our mental clarity and cognitive function, securing an optimal environment for brain health? Ensuring a diet rich in these nutrients is a simple yet effective step towards a sharper and healthier mind. 4. Makes red blood cells. Vitamins B6, B9, also called folate, and B12 are vital for making red blood cells in our bodies. Red blood cells have an important job. They carry oxygen from our lungs to the rest of our body. These vitamins help ensure that our red blood cells do this job properly. Vitamin B6 helps create a substance called hemoglobin, which is like a vehicle that carries oxygen in our blood. Without enough B6, our red blood cells can't make enough hemoglobin, and we might feel tired and weak. Vitamin B9, folate, is needed for the growth and development of red blood cells. If we don't have enough folate, our red blood cells can become too big and not work well. This can lead to a condition called megaloblastic anemia. Vitamin B12 also helps make red blood cells and works closely with folate. Without B12, we might develop anemia and have problems with our nerves. To keep our red blood cells healthy, we should eat foods like meat, fish, eggs, and leafy greens because they have these important B vitamins. If we don't get enough of these vitamins, we could feel tired, weak, and unwell. So it's essential to have them in our diet for our overall health. 5. Fetal development. Folate, which is also known as vitamin B9, plays a critical role during early pregnancy in ensuring the healthy development of the neural tube in the fetus. This is vitally important as it helps reduce the risk of neural tube defects in the developing baby. The neural tube is the structure that eventually forms the baby's brain and spinal cord. During the early stages of pregnancy, particularly in the first few weeks when many women may not even realize they're pregnant, the neural tube is forming. Folate is essential for this process because it's involved in DNA synthesis and cell division. A deficiency in folate during pregnancy can increase the risk of neural tube defects, which are serious birth defects that affect the brain, spine, or spinal cord of the baby. The most common neural tube defects are spina bifida and anencephaly. To reduce this risk, it's recommended that women who are planning to become pregnant or are in the early stages of pregnancy take folic acid supplements or consume foods rich in folate, such as leafy greens, fortified cereals, and legumes. This preventive measure emphasizes the importance of folate in ensuring the healthy development of the baby's neural tube. 6. Skin, hair, and nails. Vitamin B7, also known as biotin, is often associated with the health of the skin, hair, and nails. It's considered important for maintaining their health and appearance. Biotin plays a role in the metabolism of fatty acids, amino acids, and glucose, which are important for the growth and maintenance of healthy skin, hair, and nails. It's also involved in the production of keratin, a protein that makes up the structure of hair and nails. While biotin deficiency can lead to skin issues, hair loss, and brittle nails, deficiencies are relatively rare in individuals with a balanced diet. Most people obtain sufficient biotin from the foods they eat, as it is found in a variety of common foods like eggs, nuts, and whole grains. For people with genuine biotin deficiencies, such as those resulting from certain medical conditions or medications that interfere with biotin absorption, biotin supplementation may be necessary and beneficial. However, for individuals with no underlying deficiency, taking biotin supplements for cosmetic purposes may not necessarily lead to significant improvements in the health or appearance of hair, skin, or nails. As with any supplement, it's advisable to consult with a healthcare professional before starting biotin supplementation to determine if it's necessary and safe for your specific situation. 7. Detoxification. B vitamins such as B2, riboflavin, and B3, niacin, are essential players in the body's natural detoxification processes. They assist in neutralizing and eliminating harmful substances. B2, or riboflavin, works by aiding enzymes that transform toxins into harmless forms. It also supports the production of glutathione, a potent protector against cellular damage. B3, known as niacin, provides cells with the energy needed for detoxification. This energy ensures cells can efficiently remove waste and toxins. Additionally, niacin promotes better blood circulation, facilitating the body's waste removal. While these B vitamins play key roles in detoxification, they are part of a more extensive network of nutrients and processes that keep our bodies clean and healthy. 8. Increases mood and mental health. Vitamins B6, B9, folate, and B12 are essential nutrients that have a profound impact on our mental well-being. They play pivotal roles in the synthesis of neurotransmitters, the chemical messengers in our brains responsible for regulating our mood. B6, also known as pyridoxine, aids in the conversion of amino acids into serotonin, a neurotransmitter that contributes to feelings of happiness and emotional balance. Serotonin is often referred to as the feel-good neurotransmitter. Folate, or B9, is crucial for neurotransmitter production. Low levels of folate may lead to disruptions in neurotransmitter synthesis, potentially contributing to mood disorders such as depression and anxiety. B12, or cobalamin, not only participates in neurotransmitter production, but also helps protect nerve cells. Deficiencies in B12 can lead to neurological symptoms and affect mood regulation. Maintaining a diet rich in these B vitamins, found in foods like lean meats, leafy greens, and fortified cereals, is vital for supporting mental health. However, if mood issues persist, seeking guidance from a healthcare professional is recommended. 9. B vitamins help regulate ED. B vitamins, particularly vitamin B3, niacin, have been explored for their potential role in improving erectile dysfunction, ED, to some extent. Niacin, in particular, has been studied for its vasodilatory effects, which means it can help relax and widen blood vessels. This dilation of blood vessels can enhance blood flow, including to the birth area, which may aid in achieving and maintaining an erection. However, it's important to note that while niacin and other B vitamins may have some benefits for ED, they are not a guaranteed or standalone treatment for the condition. ED can have various underlying causes, including physical, psychological, and lifestyle factors. Therefore, the effectiveness of B vitamins in treating ED may vary from person to person. If you are experiencing ED, it is advisable to consult with a healthcare professional. They can help determine the underlying causes and provide appropriate treatment options, which may include lifestyle changes, medication, or other therapies tailored to your specific situation. While B vitamins play multifaceted roles in our health, it's important to approach them with a complete perspective. Instead of isolating them as a means to address specific health issues, they should be viewed as part of an overall healthful dietary pattern. It's always best to obtain these vitamins from a varied, balanced diet rich in whole foods. For those with specific health concerns, deficiencies, or during certain life stages, supplementation might be beneficial, but this should always be discussed with a healthcare provider. Thank you for watching this video.